Business Excellence in a Not-for-Profit is the theme of Progress to Health Success Snapshot. Progress to Health applied to win a Regional Business Award. Let's hear how they went through that process and what the expected and the unexpected outcomes were. Please welcome Chief Executive Karen Covell.
Good morning, thank you very much for having me this morning. I must say that I've noticed some absolutely wonderful pairs of shoes out there this morning, which reminds me that I've actually got the wrong shoes on, so I feel very short up here. So just bear with me if I sort of start doing this. Now, we're going that way, second arrow down. So it's the bottom one or the top one? That one. That one.
Yes.
That one? Cool. Right. Technology is a wonderful thing. So, 1995, and on the world stage, it was the International Year of Tolerance. O.J. Simpson was on trial for murder. Daniel Loder wins a world record. The Oscar goes to Forrest Gump. The Cave Creek tragedy. TV1 and TV3 go 24/7. The Auckland Warriors join the ARL. We lose Bruno Lawrence. And the All Blacks lose that World Cup.
Yeah.
And on the New Zealand stage, institutions are closing their doors. People are finding themselves displaced in communities. And in response, Progress to Health starts its life. Progress to Health is a community-based mental health and disability support service based in Hamilton, but providing service throughout Waikato, Taranaki and Taupo. Like so many other community organisations, we've found ourselves on the roller coaster ride of attracting and keeping funding, providing relevant and real services, staying true to our vision, and meeting the challenges of various government policies. Oops, there we go. In 2005, we underwent an audit that resulted in potential disaster. One option was to shut up shop, and the other was to roll up our sleeves and start over, and we chose the latter. I took on the words of my favourite poem in a new light, and if you can't read the words on there, it says, I took the road less travelled by, and that has made all the difference, and it's from The Road Less Travelled by Robert Frost. And the brilliant people that gathered around worked with me to ask why, what if, what about, and we created services that were flexible, inclusive and responsive, and we started to deliver on our vision of communities without barriers. Services that were centre-based, timetabled, group activities with little or no bearing to a person's goals and aspirations became community-based, individually craft activities directly responding to an individual's development plan. The people using our services took to the changes like ducks to water. The staff didn't. And we had to, no real surprise there. And we had to devote and invest serious time in meeting each staff member individually to assess how much they bought into the changes, identify what the barriers were, and decide on workforce development to respond to these issues. We did lose a couple along the way, but they readily admitted that they'd been in the game too long and were too set in their ways to make effective change. In terms of technology, we introduced an electronic client management system, and I think some people in the room from that place, I'll give it a plug record base from Wild Bamboo, which over time has significantly cut down on what the staff have to report each month, as most of it can now be captured via the system. With its introduction, we have now regularly achieved full compliance for primed reporting. We also converted to a terminal server network so that all the organisation's information was held in one spot. And when we were at that time a centre of seven centres with no formal backup system, migrating to one backup system and securing our business information was a significant move. Where am I now? And as part of this transition, we reduced the number of PCs. No staff member, including me, has sole use of a computer or desk space, and individual offices were reduced. The concept of a staff member sitting behind a desk and the service user sitting on the other side has been phased out, so that staff now meet the service user where the service user wants to meet, whether that be their home, the local cafe or the beach. The board transitioned from one that accepted anyone to identifying the skills and experience that it needed. New trustees had and have to have the right fit. We intentionally put our hands up for pilots and projects and sitting on national bodies such as the NGO working group as it was back then, including the Let's Get Real HR toolkit. And speaking of Let's Get Real, we adopted the framework as the base for our orientation process. Keep doing that. I'll just put it down. At times it all seemed too much, and we felt as though we'd created something too big for us to control. But when we got it right, it was spectacular. As the years passed, we felt we were doing a good job. People were patting us on the back. People using our service were achieving their goals. And up to last year, we actually increased the number of people accessing our service by 25%. But how did we know we were truly producing something excellent? So we investigated the Westpac, and I think it's so timely that we're here with this venue. Nice plug again. Westpac Waikato Business Excellence Awards as a means of benchmarking ourselves against not only other not-for-profits, but for-profits as well. A 3-year plan was decided on. Year 1, we would submit an application. Year 2, we would build on that and aim to be a finalist. And Year 3, we would go for gold. Through the application process, we had to be able to describe and articulate our business, the services we delivered, our strategies for the future, our technologies, our systems and our processes, our environmental sustainability, our people management, how we contributed to innovation, community and our industry to a judging panel that knew little or nothing about us, the health and disability sector or the non-for-profit sector. As we completed each section, we were forced to step back and look at things as an outsider. Did what we have to say stack up? Did we have evidence to support what we were saying? If at any point we had said no, we would have had to have withdrawn from the process. For example, our response to environmental sustainability went along the lines of, just bear with me, opened in 2004, and with the support of the Tainui Environment Unit, Progress to Health's Tree Nursery, which stands for Training, Recovery and Environmental Education, provided programs based on ecological, environmental, horticulture and restoration to assist clients in their recovery from mental illness. Tree aims to empower clients through its services and programs to move back into their communities, and in doing so aims to assist in the recovery of our environment with specific focus on areas of cultural significance in the immediate area of the land used by Tree. And then we had to go on to example some of the work we've done, and so we had to list projects such as plantings within the regional park, ongoing since 2005. Plants provided for various expos and public events, such as the Tainui Festival in 2008, where the estimated attendance was 67,000 people that we had exposure to. Progress to Health applied for and was approved as a preferred supplier by Environment Waikato. And we introduced a program in partnership with Enterprising Communities to provide specific horticultural training for those with mental health issues and or long-term unemployment. So that was the sort of detail we had to go into in terms of the application. And then, as they say, timing is everything. We submitted our application and awaited the visit from the judging panel, where we had to be able to defend our application face to face. So not only did we have to have systems in place, we had to be able to write about it, we had to have the evidence for it, but then we had to be able to speak to it and provide the evidence and defend our place. A process that again reinforced to us that we had something of value, credibility and something to be proud of. Year 1 achieved. And then we made finalist. Year 2 achieved. And then not what we were expecting. And so once the celebrations were over and we were back to business, what are we left with? That little document there was the sole thing we got back from the judging panel, and I've got it here if you want to read it, but that was the sole content of our feedback. So, gave us a bit to go on. And I can't believe I actually put this photo in, but anyway, I've got two beautiful ladies standing either side of me, and they did really all the hard work. And their names are Angela Mayrick and Gwen Tariki RC. Angela is our business development manager and Gwen is our service manager, and without those two ladies I wouldn't be up here, that's for sure. Of course we have a bright shiny trophy, but now we have opportunities to strike up new relationships and partnerships and develop new business. We also have a robust, concise description of Progress to Health, its structure, systems, processes and people, which provides a comprehensive foundation for someone coming into the organisation at any level, including the board. It also gives us a baseline document for tender and request for proposal documents. The words and descriptions we have used were understood by people outside the sector, signifying that our intent and meaning should be easily translated into these types of documents and processes. And now that we've established the base document, we can just build on it and update it as we go along. What have we learned? That we were right to believe in ourselves and the services we provide. That we have something of value that others want to be part of. That we have experience and knowledge to share. I love this photo. Our board has grown in belief and determination, and for the first time in our history, the board has entirely written and taken ownership of our strategic direction, and as a chief executive, you have no idea how great that feels. So if your boards aren't quite there, get them there. We now have objectives to grow geographically and build independent revenue. We now feel brave enough to talk partnerships. We now know we have something to offer our would-be partners. Would I recommend you enter your organisation into something like this? Absolutely yes. You have to be prepared to put yourself under a microscope and then have others put you under another. But it is an affirming, strengthening process. And even if you don't win an award, you will know without doubt what your organisation is. Thank you.